The Kansas Healthy Food Initiative came because there is a recognition that there is a significant need in terms of food access for Kansans. As you can see, data from the Kansas Health Foundation indicate that over 30% of the Kansas counties are located in food deserts. And when we talk about food deserts, we're talking about where there's significant poverty and a lack of access to grocery stores. When you sort of chart it out, that translates to about 800,000 Kansans are without easy access to healthy food sources. The other thing that's interesting is that there's been a study done in over the past 5 years where they've looked at the number of states, that have addressed this issue of food deserts and lack of access. And Kansas, unfortunately, is in the bottom 5 of the states in Kansas in addressing food access. This is just a map from USDA that shows at a very general level where food deserts exist. And anywhere that you see purple are food deserts. Here's a map of Wichita and Kansas City that are a little more detailed. We actually, in our office now, have a much more granular mapping that can show access issues and food deserts across Kansas, really down to about the neighborhood level. So these are, again, very general maps and definitely don't tell the full story. What they found is that when there is a lack of access to healthy food, it really is a public health issue. And you can see in the first bullet there, the CDC, Institute of Medicine, the American Heart Association, all indicate that healthy food access is necessary to improving public health. Also, high rates of obesity positively correlate with folks that are living in food deserts, and that when you look at obesity, it's also connected to a number of different diseases and health challenges: high blood pressure, cholesterol, type 2 diabetes, heart disease. And then they found that living closer to healthy food retail is also associated with better eating habits. And so what's happened across the United States is that there has been this movement toward healthy food financing. And healthy food financing these are across the U.S. are generally connected to these kinds of programs. They're business financing programs that offer grants and loans to grocery retailers. They're administered by a variety of financing entities, especially community development financial institutions. When we talk about community development financial institutions, or CDFIs, what we're talking about are financial institutions that have built into them a social mission and a community development mission. And so their lending requirements, the lending parameters tend to be a little less rigid than your normal banks, and they are very interested in assisting communities and neighborhoods in terms of promoting community development and health. Almost all of these healthy food financing initiatives across the U.S. are funded in some kind of combination of federal, state, local, and philanthropic dollars. Different states have different sort of percentages of those kinds of dollars, but they tend to all have a little bit of that in them as they finance these healthy food projects. And then there are just numbers, there are just hundreds of these projects being supported across the United States. And there are actually 10 of these healthy food financing projects or programs across the U.S. And this slide highlights 4 of those. New Orleans, there's one in California, one in Colorado, one in Michigan, but there are actually 10 of these, and Kansas has become the 11th. So what happened is that back probably a year and a half ago, the Kansas Health Foundation created what was called the Healthy Food Financing Advisory Working Group. And this slide lists the folks that were part of that advisory group. And all I want to sort of highlight here is the variety of people that and the variety of stakeholders that were part of that advisory group. So you have you have philanthropic organizations, you have USDA, you've got some of the economic development folks around the state of Kansas. You have a distribution company. You've got Kansas State. And then the other thing so not only did you have on the left column there that shows all of the people that were on the advisory board, but then you can see some of the people that they brought in to speak, and I want to make sure that I highlight that Paula Peters did come in and talk about what K-State Research and Extension is doing in terms of promoting health, but then specifically talking about nutrition through SNAP-Ed and their FNEP program. So out of this healthy food advisory group, there were actually 7 recommendations that were generated, and what I want to do is highlight 2 of those because they're the most critical in terms of creating this Kansas Healthy Food Financing Initiative. First of all, the first recommendation that came out of this was a recommendation that the Health Foundation invest seed dollars into some kind of healthy food funding program. And they talked about how this funding program should provide both grants and loans to support healthy food retail in the state. And the other piece of recommendation 1 that was important is that the recommendation also said that these dollars should be housed within a CDFI, that Community Development Financing Institution that I referenced just a minute ago, and that they should be essentially the bank. They should be the ones that leverage the dollars and do the loans and the grant program itself. Recommendation 3 really talked about creating an entity within the state that would provide technical assistance. That it should be an entity that was connected to a variety of stakeholders around the state of Kansas, that knew the landscape of healthy food retail, that knew about the barriers of maintaining grocery businesses, and had been involved in that sector. And so so the Kansas Health Foundation, with this recommendation, reached out to Kansas State University and the Center for Engagement and Community Development to really address this 3rd recommendation. So then on August 1st of this year, the Kansas Healthy Food Initiative was launched. And in fact, it was seeded by the Kansas Health Foundation. They put in a little over $4 million into this program. And they created this partnership to increase access to to improve Kansans' access to affordable fresh food. And so again, there are the 5 partners. The Kansas Health Foundation provided the seed funding. The Center for Engagement and Community Development is really doing 2 primary things. We are providing technical assistance, evidence-based information for folks that are looking to either create or expand healthy food retail. But the other thing that we're doing is that we are our office is determining eligibility of projects, and I'll talk more about this in just a little bit. IFF is the Community Development Financial Institution. It's based out of Chicago. It has an office that we're working most closely with in St. Louis, and they are housing the funds. They are the ones that will actually put together the financial applications and provide either grants or loans for healthy food access. There is also, because IFF is based out of Chicago and St. Louis, we thought it was important that there be a financial entity within Kansas to help sort of better understand the sort of the financial landscape and parameters and of the local businesses and organizations that are applying for these funds. And so we connected with Network Kansas. And so Network Kansas really is the on-the-ground, I guess, funding analyst for the projects that are coming out of Kansas, and then they're going to make their recommendations onto IFF. And then the Food Trust is a nonprofit. It's a healthy food access nonprofit based out of Philadelphia, Pennsylvania, and they really are consultants on this project. And they've been involved with almost all of the healthy food financing programs across the country, and so they are a valuable source of information. So the Kansas Healthy Food Initiative is providing both technical assistance, information essentially, and financing through loans and grants to bring healthy food to underserved Kansans, and it's working to bridge informational and financing gaps faced by food retailers and healthy food stakeholders. So this is a screenshot of the Kansas Healthy Food Initiative website, and you can see this is and that's the URL address up there at the top, kansashealthyfood.org. And you can see that you can click here to apply. The application is on this site. It'll talk about our partner organizations, and there are some information resources that folks can identify there as well. The Kansas Healthy Food Initiative application process takes a couple of steps. There is, first of all, what we call the KHFI intake form, and this is really, there are two pieces of this. One is that some folks are communicating with us, and they are simply asking for information. And there is, on the application, there is space where if they want to talk, if they want information, just information, they can go that route. Or if they are interested in financing, the first thing that has to happen is that we have to determine if they're eligible for this financing. And so let me talk just a little bit more about that. First of all, so we've been in business. We had the official launch of the program. The program was announced on August 1st. It took everybody a while to sort of get their house in order and get processes built, websites built, application forms built, and so we officially launched on November 6th. So we've been going for about a little over 3 weeks now, but we have these are some of the requests, the technical assistance requests that we have received, and I wanted to highlight these to you all to show you the kinds of the variety of information that's being asked about, and then also the variety of locations where these requests are coming from. So you can see, there's a community in Kingman County that's asking about food distribution. There's a community in McPherson that just wants to know more about KHFI. There's a community in Franklin County that just want to know about how to bring more food access into their community, not necessarily through KHFI, but just in general. There's a community in Montgomery County that is thinking about creating a city-owned store. They want to know the advantages and disadvantages of that, and then the process of making that happen. What are the steps to make that happen? Douglas County is looking for more, a community in Douglas County is looking for more information about KHFI. The same in Comanche County. There is a rural community in Crawford County that's looking to bring healthy food retail, and they're wanting to know about the steps to make that happen. And then there's a community in Gray County that is just interested in the economic impact of Dollar General. In terms of funding, so if folks are not, if they're beyond, I guess, or not, they're beyond information gathering, they're really in a funding phase. We are interested in both for-profit and non-profit entities that are able to apply. We've already had like cities contact us and ask us if cities can apply. Some rural communities, and they can. And then there are all kinds of ideas that could be funded. So, maybe there is, I don't know, it is possible that a national grocery chain could could tap into this money if they meet the eligibility requirements. A regional grocery chain, there's actually several small grocery chains in Kansas that are somewhat regional. Uh, just a mom and pop grocery store or a family owned grocery store are certainly eligible. Other kinds of food projects as well, like farmers markets, food hubs, distribution companies, etc. In fact, so right at this point, these are the 5 funding requests that we have received completed applications for to this point. So there is a community in Sedgwick County, it's a rural community in Sedgwick County that is wanting to, they're applying for dollars to uh, essentially spruce up their store, and they believe that that'll improve profitability. There is a community in Russell County that has a convenience store, and what they want to do is they want to expand that convenience store and add that and make that section a fresh foods section. There is a proposal coming out of a community in Stafford County, and they are looking to build a new grocery store in that community. There is a Hispanic grocery store in one of our urban areas, and they are requesting funding for inventory to essentially help them buy the groceries. They've got actually the shell of the store is built. All of the electric is in it, all of the refrigeration is in it, all the shelves are in it. They're looking for funding for inventory and working capital. And then in McPherson County, there's a proposal from a private company that is wanting to develop a hydroponic farm there, and they're asking for funding for land acquisition and site development. Now, I should say that these are the 5 requests that have come in. We are in the process right now of determining the eligibility for all 5 of these. So just because these 5 are listed here doesn't mean that they're going to be eligible, but just to give you an idea of the variety of applications that we've received so far. So when we talk about eligibility, there are really 5 things. There are 5 eligibility pieces that have to be met. The application has to provide a commitment, has to indicate a commitment by the applicant to providing fresh, healthy foods. The neighborhood, the town, the area where the proposed retail operation is coming from, it needs to be in what is called a low to moderate income census tract. I'm going to talk about several of these in more detail. It also has to be, the area has to be underserved right now by fresh food retail. There has to be what we call community support or community fit. And then also there has to be, they have to demonstrate that that the person that's going to run this operation has some kind of experience in this area. In terms of the income criterion, the criteria is that they must be in a low to moderate income census tract. And we are working actually with 2 different software modeling softwares. One is a mapping software called Policy Map. Another one is I think it's called Kansas Matters, I think is the name of it. Anyway, they both provide really good detail in terms of indicating the income status of these census tracts. And so we are using those softwares to determine LMI. Then we are looking to, we also use the same software and especially Policy Map, this mapping software, to determine where food markets currently exist and whether or not those food markets are within the service area of the proposed site of the applicant. In terms of community fit or community support, we ask these kinds of questions. Does the proposed project meet community needs in terms of store quality, selection, affordability, location? Uh, is the do we does it look like the project will positively impact the well-being of the neighborhood or the community? And what we're talking about there is, well, the way that we get at all of this is through interviews. We'll interview folks on the ground. We've identified a different set, a set of different kinds of folks that we want to make sure that we interview. K-State Research and Extension staff is one of the categories of people that we plan to reach out to and connect with. But we want to know, are the residents and the community leaders supportive of the project? And then we want to know of any potential downsides to the project that are coming from the neighborhood, that might happen to the neighborhood or the community. There are some additional criteria that are going to be weighed less. These are not the five that I just listed, or the big five, those are really make or break criteria. These are additional criteria that could be where an application could get additional consideration. So are they local? Are they hiring locally? Are they going to pay living wages? Are they, is there some effort to purchase locally to where they source their food? Is there efforts to be energy efficient? Is there, if they're preserving some sort of historic building, or that's important to know. We're really interested if it's in collaboration with other community objectives or initiatives. We're very interested if they are connecting with SNAP and WIC, and that will be part of the grocery store. And then we're very interested in geographic diversity. We want to make sure that we try and fund projects from across the state. So this is IFF. This is the Community Development Financing Unit. When we did the launch, really the director of IFF gave this section of the PowerPoint, and so I'm going to go through this section, but one has to understand that I'm definitely not a finance guy. IFF has had, as it says here, they've been in this business for 30 years. They've been working in communities that have low resources. And they've been working. They've been funding fresh food initiatives for the past 7 years. This is just some of their lending statistics. You can see that. What's interesting is that IFF has already funded 2 grocery stores in Kansas, even before the Kansas Healthy Food Initiative. So even before this initiative launched, they were working in this space. So they have funded a grocery store in Wichita, Kansas, and they've also funded a grocery store in Winfield, Kansas. And so they already have some knowledge about the grocery landscape or the healthy food retail landscape in Kansas, and they've already they've made lots of connections in Kansas, and I feel pretty good about working with them. I really like them quite a lot. And so in terms of the financing, you can see here that the loan and grant programs can be used for, as it says, real estate acquisition, pre-development, construction, equipment, infrastructure related expenses. And then here are the parameters. So for loans, we're looking at loans between $10,000 and $2.5 million. You can see the terms there, 1 to 15 years, and there's their interest rates. No prepayment penalties, appraisals are not necessary, and then they talk about their flexible structure in the loans that they write. In terms of the grants, and I know that there's so many communities that contact us or that have contacted us even before this, and they're looking for funding, and grants are always at sort of the top of the list. What we want to make sure that we highlight is that grants are possible. But the applications that are grant eligible they'll be held to a really very high standard. That we're looking for projects that would very high impact would make a huge difference either in a rural community or in an urban neighborhood. Um, we we want to receive some kind of grant, they'll have to show that they have leveraged a variety of other funding sources. They've brought other funding into the project. You can see that the grants are far smaller than the loans that could possibly be given. And I guess the other thing that I want to highlight here is that so our Center for Engagement and Community Development, again, just to sort of reiterate this, our job is to, number one, provide information to folks that are looking for information. And number two, to determine eligibility of the project. Does it meet the criteria of the Kansas Healthy Food Initiative? CECD will not be determining whether a project is eligible for a grant or a loan. Those will be decisions that will be made by IFF, not us. Now we will certainly, when we determine eligibility, we'll certainly talk about how important the project might be to a community, and that will get at sort of the high impact ratings. We will also have figured out whether or not they have leveraged other funding sources, but final decisions on terms of grants or loans will not come from CECD. That will come from IFF. So again, I think that this is a really huge project. In fact, I want to say, I should have mentioned this earlier, the Kansas Health Foundation provided a little over $4 million to this project. IFF has already leveraged $4 for every dollar that the Health Foundation gave. So we're now, well over $10 million. We are actually speaking to the Federal Reserve of Kansas City in just about a week, and they're bringing together bankers from across the state. We are hopeful that some of those banks will also provide funding into this Kansas Healthy Food Initiative. So we feel like there is, quite a lot of money that is available for this, and we are very interested in receiving applications from all over the state of Kansas. And so, I would just ask all of you that are on the call that as you, do work in your counties and your communities, if you know of folks that are thinking about either building some sort of healthy food retail, or they're interested in expanding some kind of business, we would love to hear from them. And we hope that you will help us be really eyes and ears on the ground across the state. That would be of tremendous benefit to us. So again, I want to thank Nancy for this opportunity, and I want to thank you all for allowing me this time to talk about the Kansas Healthy Food Initiative. You can see here that if you have questions, there's an email that'll go to several of us here in the center. There's our phone number, and then there's our website again. And so with that, Nancy, I'd be glad to answer any questions that folks might have.